Hi, Nurse Sherry here, and today we're going to be going over the CNA testable skills, gives a modified bed bath. So the supplies that you will need to collect for this skill will be 2 towels, 1 water basin, a pair of gloves, 3 washcloths, and a gown, and your soap. All right, let's go ahead and begin our skill. Hi, my name is Sherry. I'll be your CNA today. Can you give me your name? Okay, Robert, I'm here to go ahead and give you a bed bath. Would that be okay with you? All right, we're gonna do just your face and your arm and things like that. Is there any questions you have? All right, perfect. All right, I'm gonna gather my supplies and I'll be right back. All right, and when you get your water, you wanna make sure that your water is at 105 or less, and then you must have your patient test it to make sure that it's a comfortable level for them. Okay, but you don't ever want it to be greater than 105. All right, so I have my supplies here. I'm going to wash my hands, provide privacy, and I'm going to go ahead and remove his gown first. This is the first step in the skills evaluation that you need to do, is remove the gown. And you don't want to expose your patient as you do this, so you can either have them hold it if they're able to, or you can just remove it yourself and make sure that you are covering up the patient the entire time. Okay, so I'll go to my other side. You want to try to not reach over the patient as much as possible. And anytime I give a real bath, I want to make sure I have a warm blanket for my patient, because there's nothing that feels better than a warm blanket. Okay, after I take this gown off, I'm going to roll it up away from my body, and I'm going to put it in the dirty linen area. Okay, the next thing I'm gonna do is I go get my water, I check it. It is 105, I check it with the temperature. I come over and I ask my patient to go ahead and test it. Mr. Smith, is this okay for you? Okay, great. All right, then I'm gonna go ahead and apply my gloves, and I leave this empty space here for dirty, for all my dirty washcloths and things after I'm done. All right, so the first thing we're going to wash is gonna be his face, and we never use soap on a patient for these skills. So I'm just going to get for the face. We never use soap for the face. So I'm gonna rinse my water out. I like to put it in the 4 corners. It just makes it easier for me. There's also a mitten you can use, or different other ways. Now you wanna start at the inner cannula and go outwards. So I start on this side, I go out, and then I wanna get a new piece, go this way and out. And then I'm gonna get a new piece, and I'm gonna do his forehead, come down and do his nose, his other forehead. You just wanna make sure you get the rest of his face. And I'm gonna go ahead and get the bottom portion, and I go ahead and do the neck. Okay, so this is dirty, so I'm gonna place it right here. The next step is to dry his face, and I always do a pat dry. All right, excellent. All right, the next thing I'm gonna do is grab my towel, and I'm gonna open it up as I place it underneath his arm. I'm only exposing what area I'm working on, and so I wanna unfold it. That way his arm will place right inside of here. So make sure that you support all of his joints. And then I put the towel down. All right, and I'm gonna start with this hand. So I'm gonna grab my next clean, rinse. I'm gonna apply some soap. Lather the soap all up. Make sure I get it everywhere. I wanna make sure that our patients are clean, right? All right. Then I'm gonna fold it back in my squares. It just makes it easier for me to know what's clean and what's dirty. And I'm gonna start with his nails, and I'm gonna go through and do each nail. After I do the nails, then I'm gonna do each finger. You wanna do inside each finger, right? And then I'm going to clean his arm with this soap. And just make sure I get every area. And then you want to make sure that you get the armpit. And for the skill evaluation, you just have to do one arm. So this is dirty. I put it in my dirty pile. I grab my rinse because it's always wash, rinse, and dry. So I'm going to fold it. And if you can see you have 4 leaves when you fold it. I like it that way. All right, so then I'm gonna do his nails, rinse his nails off. Then I'm gonna do each finger. And most likely you'll do it on a live person. And then I'm gonna make sure I get his hand and his arm. And then his armpit. Okay, I'm gonna put that in the dirty area. Then I'm gonna fold this around. And I'm gonna start again and dry his nails. Then I'm gonna take the towel and go in between each finger. We really wanna make sure that it gets dry in those areas. And then I'm gonna pat dry his arm and his armpit. Okay, and I'm gonna go ahead and take this out and cover his arm back up. And I just keep all my linen right here. And I'm gonna go ahead and remove my gloves and toss it in the trash, wash my hands, and I'm gonna grab the new clean gown. When I put the gown on, I put it over the blanket. That way I know I'm not exposing my patient to anything. And you can either snap these after they get on the patient or before. If they have an IV or something, obviously you're going to want to snap it afterwards. Otherwise, you can snap it before. I'm just going to slide the gown on. And then I'm going to come over to this side. So it wraps around, and then you snap each one. Okay. And then, Mr. Smith, I'm just going to tie this behind you, and I bring it off to the side to tie it so that he's not laying on that tie. Okay, then I'm going to bring the sheet out and place it on top of him. All right, I'm going to check the bed, make sure that it's still locked. I'm going to come over here and give him his call light. All right, Mr. Smith, is there anything else I can get for you? Are you comfortable? Okay, wonderful. All right, and so then I'm going to take my supplies. Then I'm going to take my basin and I'm going to empty it into the sink. I'm going to rinse it out, and then I'm going to take a dry towel and I'm going to dry inside. Okay, and then that way we have a dry basin. Then I'm going to take this and fold it up into my towel here. Take this to the dirty linen, toss it, and wash my hands. Skill complete. And I'd give him his tray back because usually patients have all their stuff that they need on here. And that is how you give a modified bed bath. Thank you very much. Have a good day.